Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Kidney Health and Disease video series. Today is the time for the second video of the series, which is what happens when your kidneys are ill or do not work very well. We're going to define chronic kidney disease and renal failure. We're going to mention the stages of chronic kidney disease and the symptoms of chronic kidney disease, and end up mentioning some of the complications of this disorder. So let's define chronic kidney disease and renal failure. Chronic kidney disease is the consequence that many different disorders have in the kidneys, damaging them progressively and impairing progressively all the kidneys functions that I mentioned in the last video. Total renal failure is the total damage of the kidneys, which is typically irreversible. When the kidney function drops below 10% of the normal, the patient can become very ill and the situation can be life-threatening, and dialysis or a transplant needs to be performed. So let's mention the stages of chronic kidney disease. There are 5 stages of chronic kidney disease, from 1 to 5, being 5 the most advanced. It is classified according to the GFR, which stands for glomerular filtration rate, and is a measurement of kidney function. In stage 1, the GFR is normal, that is, the kidney function is still normal, but there is already detectable damage to the kidneys. From stages 2, 3, and 4, the damage is worse, and the kidney function starts dropping progressively. By stage 4, the patient probably already needs to start preparing for dialysis or for a transplant. And when the patient reaches stage 5, the patient can feel already very ill and the situation can be life-threatening. And dialysis needs to be started or a transplant needs to be performed. So what are the symptoms of chronic kidney disease? You recognize this slide from the previous video. So when the kidneys are ill, they cannot control the water content very well. So the patient starts retaining fluid and become breathless. The blood pressure becomes very high and can damage many organs. The patient can feel very weak, very lethargic, nauseous, with vomiting, severe itch, or simply unable to sleep or concentrate because all the toxins are building up because the kidneys cannot clean the blood properly. The patient becomes anemic and weak because the kidneys are not producing erythropoietin, and the patient needs to have erythropoietin as an injection. The patient can have bone pains, deformities, or fractures because the kidneys are not activating the vitamin D necessary for calcium absorption and to make the bones stronger. And there are a lot of dysregulation with phosphorus and other problems on mineral metabolism. There are also an imbalance in the salt levels of potassium, sodium, calcium, phosphorus, and many other minerals, which can be life-threatening also. The kidneys are very important. The function of the kidneys by cleaning the blood is very important. Just imagine the function of a cleaner. Imagine a restaurant in which the kitchen or the toilet is not cleaned properly for 1 hour, for 6 hours, for 1 day. Imagine it for 1 week. There will be a time that all the functions of the restaurant will stop. The same happens to our bodies. So when the kidneys are ill, many other organs are affected. For example, patients with kidney failure are at increased risk of heart attacks, heart failure, or arrhythmias. The blood pressure can go very high and damage many other organs, and the potassium can go very high, which can even make the heart stop. As I mentioned, the bones can become very weak. The muscles also become very weak. The patient can become malnourished. And because of the toxins in the blood, what is also called uremia, the patient can bleed from the stomach. Many other organs don't perform their functions very well, like the liver. The patient becomes anemic and requires erythropoietin or maybe blood transfusions. With the fluid retention, the patient feels breathless. The oxygen levels drop, and maybe the patient have decreased mentation and also increased risk for stroke. So I hope you find this video useful. If you like it, please give us a thumbs up. Subscribe to our channel. Stay tuned for the next videos. The next one will be the symptoms of inflammation of the kidneys, which is called glomerulonephritis. Thank you very much for your attention. Bye-bye.